Hi there, Dr. Mandel here. Monitoring your blood pressure at home is a fantastic way to take control of your heart health. But many people unknowingly make mistakes that can lead to inaccurate readings. And these errors could result in missed opportunities for early detection of high blood pressure, and they can actually cause unnecessary worry. In this video, I'll cover 15 common blood pressure mistakes and show you how to fix them. By the end, you'll be able to get the most accurate readings and then take full control of your health. So let's jump right into it. Mistake number one, measuring blood pressure right after exercise. Exercise is definitely crucial for your health, but it temporarily raises your blood pressure. And if you measure your blood pressure right after you work out, it can give you a falsely high reading. And when you exercise, your heart rate increases, and your body is working harder to pump blood right through your muscles. And to avoid inaccurate results, wait at least 30 minutes after exercising before checking your blood pressure. This gives your body time to return to its resting state, allowing for a more accurate reading. And mistake number two, not resting before taking your blood pressure. When you rush to take your blood pressure without resting, you could be influencing the results. And if you feel stressed, rushing, or even anxious, your blood pressure could definitely spike. And that's why it's essential to rest for at least 5 minutes. That's the magic number, 5 minutes before taking your blood pressure. So find a quiet, comfortable place, sit down, and allow your body to calm down. Resting ensures that your blood pressure is at its baseline level, giving you the most accurate measurement. The more relaxed you are, the more precise the reading will be. And mistake number three, measuring blood pressure with a full bladder. I can definitely attest to this one. It's often overlooked, but a full bladder increases your blood pressure. This is because your body is working harder to function even though you're just sitting there. If you feel the urge to go, don't ignore it. Before measuring your blood pressure, empty your bladder. This simple step will make a noticeable difference in your readings. Studies have shown that a full bladder can elevate your blood pressure by as much as 10 points. And mistake number four, sitting in the wrong posture, sitting in the wrong position. That many people underestimate the importance of posture when measuring your blood pressure. And if you're slouching, leaning forward, or even crossing your legs, it will affect your reading. For best results, sit upright with your back supported, feet flat on the floor, and your arms supported at heart level. Very important that your heart and your arm are at the same level. And number five, using the wrong cuff size. The size of your blood pressure cuff matters more than you may think. If you use a cuff that's too small for your arm, it will lead to a falsely high reading, while a cuff that's too large may make your blood pressure appear lower than it actually is. And most home monitors come with a cuff that fits average-sized arms, but if your arms are particularly small or large, you may need a different cuff size. So to determine the correct cuff size, you want to measure the circumference of your upper arm and check the manufacturer's guidelines for the appropriate cuff. And number six, rushing the measurement process. Taking your blood pressure too quickly can compromise the accuracy of your readings, and if you rush through the process, the cuff may not inflate or deflate properly, leading to unreliable results. It's essential to take your time when using the monitor. Allow the cuff to fully inflate, wait for it to deflate slowly, and stay calm throughout the process. And mistake number seven, measuring blood pressure at a different time of day. Blood pressure naturally fluctuates throughout the day due to various factors like activity, or stress, or even your diet. And that's why measuring it at different times of the day will definitely lead to inconsistent results. And for the most accurate and reliable readings, it's best to measure your blood pressure at the same time every day. Morning is often the best time before eating or drinking anything when your body's still in a rested state. And mistake number eight, not taking multiple readings. One reading is often not enough to get an accurate picture of your blood pressure. A single measurement can be influenced by a variety of factors such as stress or a slight movement. Take at least 3 readings if you have to, 2 or 3, with a minute or so in between. This helps account for any temporary fluctuations. Afterwards, you can average the results to get a more accurate representation of your blood pressure result. Mistake number 9, measuring blood pressure over clothing. Measuring blood pressure through clothing is one of the most common mistakes people make. Fabric will obstruct the flow of blood flow and interfere with the cuff's ability to get an accurate reading. Always remove any sleeves or tight clothing from around the area where the cuff will be placed. And mistake number 10, ignoring regular calibration. Just like any electronic device, Blood pressure monitors can lose accuracy over time. If you don't calibrate your device regularly, your readings may become less reliable. It's recommended that you calibrate your monitor every year or whenever you notice inconsistencies. Sometimes it's better off that you just buy something that's new and fresh that works the right way. Mistake number 11, not recording your readings. Tracking your blood pressure over time is crucial for understanding your health, and if you don't keep a record, you might miss important changes your blood pressure is showing you. It may indicate some underlying problems. So be sure that you record your readings after each measurement. You can use your blood pressure log or a smartphone app to track your results, which will also make it much easier for your doctor to monitor your progress as well. And mistake number 12, using an old or low quality monitor. Not all blood pressure monitors are created equal. Older monitors are cheap. Unapproved devices can actually give you inaccurate readings, which might not reflect the true blood pressure reading. Always use a validated FDA-approved monitor. That's very important. If your monitor is more than a few years old, it might be time to upgrade it. And mistake number 13 is talking during the measurement. So many people do this, myself, the doctors, the nurses, but talking during the measurement process is a common mistake. It's tempting to ask questions about their health or their day or engage in conversation, but talking can cause your blood pressure to rise temporarily. And mistake number 14 is forgetting to check your technique. If you've been measuring blood pressure for a while, it's easy to fall into bad habits. Over time, you might skip important steps or use incorrect techniques without realizing it. Regularly check your technique to ensure that you're following all the proper steps. Double check your posture, the placement of your cuff, your monitor settings to avoid errors. These little small mistakes can add up, and taking a moment to review your technique will definitely ensure the consistency and accuracy of your measurements. And mistake number 15 is not seeking medical advice when needed. Finally, if your blood pressure is consistently high or low, don't ignore it. Don't self-diagnose your condition on your readings alone. It's crucial to consult with a healthcare provider if you've noticed abnormal trends. High blood pressure often has no obvious symptoms, so regularly monitoring your condition with professional guidance is definitely the key. So there you have it, 15 common blood pressure mistakes and how to fix them. Now, with these tips, you have a better understanding how you can take care of yourself, your family, as well as your loved ones. Please share this video with your friends and family, leave your comments below, and most important, make it a great day. I'm Dr. Alan Mandel.